Okay, we're back, and we're going to talk now about hepatitis, which we know is a virus, very, very hard to cure. Some people have it forever, others we can manage it fairly well. And we know it's a systemic viral disease that primarily affects the liver. All strains can cause hepatic cell necrosis, so that means death. The Kupffer cell hyperplasia and infiltration of liver tissue by mononuclear phagocytes, which is going to obstruct bile flow and impair everything that the liver cells do. Hepatitis, formerly known, hepatitis A, I'm sorry, and we look at all the strains. We go from A to G. I listened to a GI fellow talk one time, and he said, before we're all done, it's going to go through the whole alphabet. Isn't that amazing? So all strains can cause hepatic cell necrosis. Well, I already said that. Hepatitis A onset is acute. Children and young adults get it. Prognosis is pretty good. Formerly known as infectious hepatitis. And A is both fecal oral and sexually transmitted. B is formerly known as serum hepatitis. And any age can get this. From 6 months on up, it can actually be, it's one of the worst ones for when you're pregnant because it goes clear across the placenta and the baby's born with it. And B is sexually transmitted. Then hepatitis C, D, E, and G. E is the only one that's fecal oral now. A, B, C, D, and G are all sexually transmitted. So let's say it again. A and E are both fecal oral, but A now they're saying it can be transferred sexually. B, C, and D are all bloodborne pathogens, and they're all sexual. Hepatitis B and C are both sexual and mode of transmission. Hep D is both sexual and fecal oral. And Hep G was discovered in 1995. The virus HGV transmitted parenterally and sexually. So there you go. They just keep coming up with different strains because viruses are pretty smart. And again, here we'll take them apart a little bit. Hepatitis A can be found in feces, bile, and sera of infected individuals, usually transmitted by the fecal oral route, but it can be sexual. Risk factors through crowded, unsanitary conditions would be possibly prisons, even sometimes dormitories where you've got a lot of, or fraternities, a lot of people in one area, and sometimes where food and water is contaminated because it is fecal oral. B is transmitted through contact with infected blood, body fluids, or contaminated needles. Maternal transmission can occur if the mother is infected during the third trimester. Hepatitis B vaccine prevents transmission and development of hepatitis B. And of course, that was discovered many, many years ago. And it was a breakthrough for hepatitis B. Hep C is considered the chronic. That's how I remember it, is C to chronic. Is responsible for most cases of post-transfusion. After transfusion, people that get hepatitis. Also implicated in infections related to IV drug use. So again, bloodborne pathogen. And it is sexually transmitted. 50 to 80% of hepatitis C cases result in chronic hepatitis. So they can die. Very, very sick. Hepatitis D, again, sexually transmitted. Depends on hepatitis B for replication. So there you go. You have to already have hepatitis B. Hepatitis E, fecal oral transmission, and in developing countries. Hepatitis G is the one recently discovered in the last 15 years, parenterally and sexually transmitted. So you're like, well, what makes them all different? They're actually the viruses are a little bit, very similar, but a little bit different in the microscope in how they're made. So the sequence of all hepatitis, they go through what we call an incubation period, an icteric phase, which they're really, really sick during that phase, and then a recovery phase. So let's look at that. Incubation phase is how long it takes, it takes to incubate, and they're all a little bit different. Like when you're actually infected and you can infect other people, but you don't know you're sick yet. That's the incubation period. And the next one is called pre-icteric, or prodromal phase. It begins 2 weeks after exposure, so you're done with the incubation period. And icteric always means yellow, and it ends with the appearance of jaundice or yellowing somewhere, marked by fatigue, anorexia, malaise, nausea, vomiting. So you feel like you got the flu, but you've got a little yellow look to you. Headache, hyperalgia is achy joints. Cough, possibly, and usually a low-grade fever. Infection is highly transmissible during this phase, any prodromal phase. And then the icteric phase, it begins 1 to 2 weeks after the prodromal phase. So now you've been in the incubation phase, can be anywhere from, let's see, I had it here somewhere. I thought I did. I don't know how many weeks it is. I thought I had it here. I guess I don't. Okay. But prodromal is going to be about 2 weeks after exposure. And so now you might be 4 weeks in before you actually, this is the area where it's the clinical phase where you're very, very sick, is the icteric. Lasts 2 to 6 weeks. So you can be sick with this stuff for a couple months. Jaundice, yellowing of the skin, dark urine because we've got bilirubin spilling into the urine. Clay-colored stools are common, and why are they clay-colored, like gray? Is because bilirubin that's conjugated in the liver makes, it's unconjugated bilirubin, goes to the liver, it's conjugated in the liver, and then it comes out of the stools. It makes our stools brown. Well, it's not being conjugated right because we have a sick liver. So we have clay-colored stools, it's going out the urine, we have dark urine. The liver is enlarged because it's inflamed, as in the itis and hepatitis. It's smooth and tender, and percussion causes pain. Usually when somebody pops on your liver in your belly, it does not hurt at all, but it's inflamed, so it causes pain. And this is the actual stage of illness, the icteric phase. Recovery phase, it can take up to weeks. It depends on the host. It depends on how old you are. It depends on how sick you got. And it depends on how healthy your liver was to begin with. And usually the recovery stage begins with the resolution of the jaundice, meaning all of a sudden the liver is kicking back in. Prognosis can be very poor if edema and hepatic encephalopathy has developed, meaning edema where third spacing fluid out. We've got that capillary permeability that is not putting fluid in the right compartment. And hepatic encephalopathy, we've got ammonia levels in our body that are extremely high, causing brain damage in our brain. So recovery can take up to weeks. Liver function returns to normal 2 to 12 weeks after the onset of jaundice. So again, you can be sick for a very, very long time. And they're going to be looking at your liver enzymes, your bilirubin level, things like that. Chronic active hepatitis, the persistence of clinical manifestations and liver inflammation after acute hepatitis B, C, and D. Liver function tests remain abnormal for longer than 6 months. Remember, any chronicity is between 3 and 6 months. And hepatitis B surface antigen persists. It doesn't go away. This is a predisposition to cirrhosis and primary hepatic or liver cancer. Arthralgia is fatigue, neurologic, and renal symptoms. So the treatment of hepatitis, what are we going to do? Well, of course they're going to rest. They're in a mess, and they're full of pain and so forth and so on. We're going to tell them to avoid alcohol. We know alcohol is metabolized in the liver, and it's a drug, or other drugs to prevent further hepatic damage, liver damage. Parenteral nutrition, if the patient can't eat due to vomiting, parenteral is through the IV. Chronic Hep B, thymidine nucleoside analog, which is a medication that we can give. And then Hep C, people get interferon, alpha 2B, and whatever that is. It's a special type of interferon. So all forms of hepatitis, there are no meds for except for hepatitis B and C mentioned here. That's it. The rest of them there are no meds for. They basically just need to rest. And we will do all kinds of therapies for them, fluid therapy, keeping them comfortable if they're in pain, so forth and so on, and let it run its course. Liver is a hardy organ, though. And then the worst one is if it goes into what we call fulminant hepatitis. It's a syndrome of its own, resulting in severe impairment or necrosis of the liver cells. The hepatocytes are not recovering from this inflammatory condition and potential liver failure. If you have enough necrotic hepatocytes, you're going to have liver failure. And again, results from impairment or necrosis of the hepatocytes. Okay, now we're going to talk about cirrhosis a little bit. And this is irreversible inflammatory disease that disrupts liver function and even the structure, the way the liver looks. Decreased hepatic function due to nodular or fibrotic tissue synthesis. I'm thinking I have a picture. There we go. There's the cirrhosis. See the nodules, the big fat nodules, and of course the one in the bottom is much worse. They're big in necrotic areas. But the liver on the top, as you can see, all those little bubbles, or they look like blisters. They're, it says it has a cobblestone appearance. That's it. Cobblestone. That's the word I'm looking for. Appearance the liver does when it's starting to be destroyed. The liver should be shiny. It's a very shiny looking organ. Okay. So let's see. Let's go back. And that's the fibrosis that we see. The biliary channels become obstructed and cause portal hypertension, which we've already gone through. That's where all the blood goes through the liver. Due to the hypertension, blood can be shunted away from the liver, and a hypoxic necrosis develops. A leading cause of death in the United States. Nodules of the of the regenerated tissue form between fibrous bands, giving the liver a cobbly appearance when it should be very smooth. It may be larger or smaller depending on the level of necrosis and swelling than usual, and is usually very firm and hard with palpation, and it should not be hard. It's classified by cause. We can either have alcoholic, biliary, or post-necrotic cirrhosis. I'm going to stop here. We'll talk about the difference in them in the next. So this will be, I think, the 4th video, and then hopefully we can finish it in the next 2. Okay, I'll be back.